give people a couple more minutes.
Social stress stats. Like, wait, and give a talk.
Yeah, and it's attention because you don't want to penalize the people who are actually on time.
Right. Yeah. Part of teaching when they switched to like Michigan time of attendance.
Started then. All right. Well, thank you everyone for joining us both in person and this is online as well. I want to welcome Dr. Miller, who's a developmental psychologist and has been a faculty member at University of Michigan's School of Public Health. She received her Ph.D. in developmental psychology here at U of M and then completed a postdoctoral fellowship in psychiatry at Brown School of Medicine. And most of her work concerns children who are growing up in poverty, who have had adverse childhood experiences and other social determinants of health, such as poverty that negatively impact health during childhood and across the lifespan. The research has been funded by the NIH, CDC, USDA, and many others. A goal of her work is to apply developmental science lens to designing, implementing, and evaluating prevention and intervention strategies for children and families. Dr. Miller has worked with community partners, including pediatricians, community-based organizations, Head Start programs, school systems, and UM colleagues across other disciplines. It really gives me great pleasure to welcome her today. I'm really interested to hear what you have to say about firearm safety, injury prevention, and childhood. So thank you for joining us.
Thank you for having me. And I will just say, I think the last time I did give a talk at CHEAR, it was in the old space where I also was for many years at the Center for Human Growth and Development, which is now defunct, but existed for like 50 years. So it's nice to kind of re-engage with the child space on campus in different ways. So yeah, as Jeremy said, I'm a developmental psychologist, and so I've done lots of different topics, a lot on sort of physical activity and childhood obesity and eating behavior and sleep, and firearms is new. But I came to it, as many of us do, with these cross-disciplinary like connections through some colleagues. And so I have an MPI on this project who is an expert in firearm injury prevention. And she and I have been working on this. We've been talking about this project for a long time. That kind of came to fruition just this past fall. So it's sort of brand new. And if I get time, I have a really messy like initial draft of results from some interviews that we've been conducting. But I'll kind of go through the logic before I get to that. So yeah, so parent engagement approach, thinking about early childhood. So what I wanted to do is kind of just talk about developmental factors shaping child health in general, which is, I know, like near and dear to this audience, and just kind of taking a developmental perspective, and then factors specific to kind of firearm injury risk in this age group and why that's important. And then I'll talk a little bit about our plans for intervention and this study, which we're calling internally the Safe Arms study. But one of the kind of points we're at now is how do we engage parents around this topic? And so is Safe Arms a good name? Is it not a good name? We don't know. We're going to talk with parents and community stakeholders about that. Okay, so developmental factors shaping child health. This is probably I show this a lot just to sort of situate like what the kinds of things that I work on and do. Okay, here's this. So SDOH is social determinants of health, which can take lots of different forms. And again, probably many of these are familiar to folks in this room. The focus of my research really has been in this space, kind of linking up these bigger social determinants and social contextual factors with child sort of self-regulation, stress responses, the experiences that children have with their parents, this kind of thing, and then how that translates to emotions and behavior development in kids, attention, cognition, implications for school, and then also physical growth and development. So again, just sort of really broadly, I've looked at a lot of these different outcomes using this kind of framework in thinking about early childhood and just early childhood specifically as a sensitive period for prevention of many of these outcomes. So kind of turning to the developmental science literature in general, what do we know is good for children? We know that sensitive and responsive parenting is really foundational, and I'm talking about early childhood, 0 to 5-year-olds primarily. So much of my work is really with like infants, toddlers, and then the preschoolers seem kind of old in some of my studies, but this study is definitely going to engage a lot of toddlers. We know that parenting is really critical. We also know some sort of specific pathways that are probably pretty relevant for the firearm injury prevention space in early childhood. And, you know, key pathways in general are the sort of caregiving relationships, so that early serve and return kind of interaction between mother and child, focus of like decades of research in developmental psychology. People are bringing that more into the health space and saying, how can these early relational health indicators like protect the child-parent relationship and the children going forward. Where I'm particularly interested in this study is that kind of red box. So parent awareness and knowledge of child development and developmental expectations. So we can think about how that's relevant for firearm injury prevention. Also, another key pathway is kind of parent or family level modeling of healthy behaviors. And in this case, one of the behaviors we're focused on, is some of the behaviors we're focused on are safe parents. It's all good. And another piece is this sort of idea of consistent regular family routines. So again, I've studied this in the context of like family meal times, bedtime behaviors, other things, and now we're turning to firearms. The other thing that I always talk about, and I would be remiss not to talk about in this talk, is that community connection and support for parents is a critical need and a critical focus of all of my work. It's not necessarily as much the focus of this study, but I always want to put that out just to say like parents are often facing, and I'll talk a little bit about this, high levels of stress, community context they can't control. And so we really need to be mindful of what the parents are facing in that work when we're talking to parents. I also tend to talk about relational health across different levels of a social ecological model in which families are nested. So that means relationships between kind of parents and their providers, maybe their pediatricians, also relational health among that sort of, I call it like a tertiary level. So between pediatricians and community, like for example, food providers or housing, people who work in the housing sector. So working on behalf of children and families, when those folks have better relational health, that will support family development more. Also, I'm happy to take any questions. I guess I'm telling them to talk. Okay, so what do I mean by expectations and knowledge of child development? Again, this might be pretty familiar to this group. I'm often talking with public health students who really do not have much background in child development. And so this is a slide that I tend to show in my class. And just to illustrate, these are the months that the age the child is in. And I mentioned I'm in sort of infant and toddler zone here. Here are the kinds of behaviors and what they look like and how they develop, and the implications for the developmental maturation here for the rest of life, right? So we can think about baby proofing as a really obvious implication of these developmental milestones. And then the other thing I like to highlight is just that wide red band indicates individual differences, right, in terms of when kids hit these milestones. So I think one of the things that doesn't quite happen enough in a lot of like parenting interventions, for example, is this sort of focus on building appropriate developmental expectations. And I use the example of like, not that any kids tie their shoes anymore, but like kind of a 2-year-old, right? Be responsible even for like Velcroing their shoes as opposed to the parent putting on their shoes. And so like, when does that happen? When can you expect a 2-year-old to, or a 3-year-old to do their own shoes? And so this is really, I think, pretty foundational, but again, it's kind of lacking from some parenting interventions. And I mentioned that it's relevant certainly for injury prevention of all kinds, and we think about it kind of as implications for baby proofing. So setting the water heater, putting the gate at the top of the stairs, this type of thing. Another kind of key example of like a developmental science piece of knowledge that we have that has implications for firearm safety and injury prevention in general is this idea of attachment theory. Again, probably familiar to many folks, but that idea that a parent serves both as this child's secure base from which they can gain support and comfort, and then also allows the child to explore. So what we talk about in attachment research a lot of the time is like either the child's not letting the parent's not letting the child kind of explore their environment enough, or the child is only exploring and they're not ever returning to that secure base to get their comfort. And so when thinking about firearm injury prevention in childhood, it's really thinking about that tension between I want my child to explore and have, get to know their household, manage, climb stairs, do all these things that we do in early childhood. But I also need to make sure that that home is secure in terms of firearms that I might own. And so that what that means really is safe storage practices, which I'll talk about. Okay, so this is kind of that tension, right? So curiosity and independence in young kids are certainly things we want to encourage, and they often come with risk. And so we do have models for talking with parents about those risks, right? I mean, like we're parents, so we probably all witnessed these situations and like, oh, I think it's really great that she's climbing up there, but oh man, if she wipes out, she might like knock herself in the head, right? The pictures over on the, well, really all of them, one could think about, ways to monitor its safety there. So for example, like with that cabinet or dresser, I hope it's bolted to the wall. Certainly as a parent myself, I had an experience where my daughter like pretty much did that, was not bolted to the wall. And I was like, and then we bolted it to the wall. But also big picture thinking about parents who, are in a rental property and they can't bolt it to the wall. Like how do we kind of work with parents who are in these situations that they can't control? There's the sparkler and the hot pot, and then the little kiddo climbing up the stairs. And there may be a gate at the top of the stairs. So those situations on the right are a little more ambiguous. But I think they also illustrate the kids like to explore. They're in their house. They have lots of different places that they like to go and explore in their house. And of course, if we have firearms in the house, it becomes more dangerous, right? It's a clearly dangerous situation if kids are going to get into that their exploration. Why is this so important? Why do we really need to think developmentally about preventing risk for firearm injury in early childhood? Well, it came as a little bit of a surprise to me when I started sort of chit-chatting about this with my firearms colleagues, is that actually the 0 to 5 age group is the next highest age group after teens who are injured by firearms. And the numbers, unfortunately, these are from the Everytown Research Group, who keeps track of unintentional shootings. And they have been growing over time. But so it's not a huge number, but there from 2015 to 2020, it was 610 children that were sort of identified in the records who shot themselves or someone else, usually at home. And the other thing to note here is that these are from prior to 2020, and 2020, there's lots of reasons, but certainly during the pandemic, purchasing of firearms, especially by novel or by new firearm owners, went up dramatically. There's some sort of, interesting differences in there by like social economic status, race and ethnicity, et cetera. But there's a lot of data to show that people were buying firearms for the first time. And so this is relevant too when we think about socialization around firearms and motivation for why one would have firearms in the home. Okay, the other thing, again, we work with young kids, we can imagine this, is that usually when young kids are injured by a firearm, it's often fatal. And so just because you can imagine why. That is another just way to show also the sex differences here. Probably not surprising. There's lots of different pathways that could lead to these differences in sex, by sex in the number of fatalities. an obvious example is something that came up a lot in our interviews that I'll talk about, but the sort of modeling of like superhero behaviors, right? Like that's generalizing, but somewhat more common in young boys compared to young girls. So that's another piece. I don't know if people saw this. This was a video like captured on a Ring camera. This kid is out, clearly not supervised, not a great situation, like wearing a diaper, but he walks around for like almost a minute and he's kind of randomly aiming, not even aiming, I would say just sort of holding this gun that's actually pretty heavy for his hands, because it's sort of drooping at points in this video, and he goes kind of all around all the different doors. And so it's a really alarming and disturbing video to watch. And so you think like, okay, we have these numbers, maybe this is in part, this is an extreme situation. I think looking in the kitchen in that top shelf is more common, but this type of situation does occur. And so there's a few more numbers. We know that most of these fatalities are self-inflicted. Most of them occur at home. And then we have some data, although I would say these are not great data. They're sort of put together from reports. The CDC is starting to track this more, sort of the context under which these shootings happen. For those remaining statistics, what would you guys have hazard a guess as to the percentage of firearms that were stored loaded, or the percentage of firearms that were stored unlocked?
90+%.
Yeah.
Firearms within someone's house, like
Yeah.
35% loaded, 70% unlocked. Oh,
90+% for both.
excellent.
Um,
Oh, these are of fatalities.
yeah.
Oh, I
Yeah,
thought you meant
not in
all
general,
firearms.
not in general. No,
Oh,
and we don't
fatalities.
know, we're like collecting some of the
Right.
this
I didn't
firearms
realize it was of
with the
fatalities.
fatalities, yeah.
I would have guessed higher.
Okay. That's good. So what, I mean, yeah, I'm happy to just share like some of the things we've learned in our interviews with firearm experts, which we'll get to, but it is, probably people in this room know, but funding for firearms related research had been available for like the past forever. And then has recently become more available. So they're able to track these more carefully, but the data sources and details are often really lacking still. So colleagues at that Firearms Institute are really focused on this and developing surveys to really ask in more detail about why do you own a firearm? What do you do with it? How many firearms are in your household? And so some of the answers from, for example, especially rural families who are like hunting, have firearms for the purpose of that, have many, many firearms at home. They also have a very sort of regimented way that they address, and care for and store the firearms. So it's this very interesting, lots of different pockets and styles, if you will, or profiles of firearm owners.
Does this imply that 8% of fatal
Right.
items involve the child loading the gun?
Good.
Or measurement error?
Unless they were hit with the gun.
Yeah, if it was self-inflicted, it might have been not the self-inflicted ones, but I would bet that, and this is also under 15. So they could have for sure
Yeah.
loaded. But the recommendation is locked, unloaded, ammunition stored separately, and also locked. So that's a lot of things, right, to do if you're wanting to own a firearm for like protection. That's kind of a big task at some level.
Yeah, so does the NRA or other pro-gun organizations keep these kind of statistics as we're doing the right thing and people want their firearms, and like it would seem that even if the federal government isn't allowed to fund research because the pro-gun lobby is afraid that it's going to shine a negative light, that the pro-gun lobby would keep their own statistics to shine positive.
Yeah, that's a great question. I think that that is true, but I'm not an expert in the things that they're tracking. I have a feeling that some of the firearms folks are looking at it like exactly that question and trying to kind of match up what's available from different sources, but it's hard to get those data. Let's see, thinking again, just kind of back to that developmental picture, but if we're thinking about childhood injury prevention in general, there's this sort of developmental trajectory of parents corresponding to the developmental trajectory of kids roughly that, you know, kind of in the early years, there's more focus on sort of the hazard removal. And then as they get older, kids get older, parents are teaching about home safety and home safety rules. And so again, thinking back, or I don't know if anybody has like a young child at home and, you know, imagining teaching safety rules or other kinds of rules to a preschooler, like they follow them, you know, sometimes, not always though, right? And I think it depends on the child, it depends on the situation and what's going on that day. And so in that case of firearm safety, we want to be really aware of this idea that parents tend to really overestimate the child's capacity to follow safety rules and the likelihood of following them. So that, you know, my child would follow this rule in all conditions. And when we think about sort of basic child development in this early childhood phase, we know that's not always the case. And so one of our questions too is that could parents also be thinking about that, like motor development, physical development, could parents also be kind of underestimating their capacity to access or likelihood of accessing firearms? And so I'll talk more about what we like dove into in our interviews so far. But I think it's this interesting kind of, you know, in parenting, thinking about, I need to believe my child, you know, not my child, right? My child will not touch these firearms if they find them because we've focused a lot on this rule and I've socialized my child around these firearms. But I'm also maybe not as aware that, for example, children's, even like 2 and 3-year-olds can sort of pull a trigger. It doesn't require that much finger strength to actually fire it. And so it's very easy once a child finds it for something to happen. So this whole project is kind of geared around understanding these perceptions of risk, understanding child development, and how we kind of can maybe message around not always trying to heighten perceptions of risk, but just sort of trying to get parents to focus on that sort of basic core aspects of child development in this firearms context. Okay. So we know that firearms are a bit of a special case. We've already talked about the NRA, you know, clearly it's a political hot button issue. But the little research that has been done sort of prior to a few years ago on parent awareness of risk is this idea of parent misconception. So there's this disconnect in parents' expectations that the child won't find the firearm. If they find it, they won't touch it because they've been socialized and have these rules around firearms. There's also the really important point about motivation to own firearms, right? If you're owning firearms for safety, and if you're thinking, I need it accessible, I need it because my block is dangerous. I need it because I live in a rural neighborhood or in a rural, you know, setting, and the police won't come if something, you know, goes wrong and it's going to take an hour, or police won't come for lots of reasons, or I need to protect myself, or I have, you know, interpersonal violence history. So like so many different reasons for needing to access that gun quickly. And I think that's one really key point. I already mentioned hunting motivation and sort of like motivation to own guns for recreation and sport, right? So I think those are very different potential pathways for thinking about how we educate and engage parents around firearms prevention, firearm injury prevention. And of course, the other thing is this big question about who do parents trust, right? We know that pediatricians, this varies by state because of policies that vary by state. But pediatricians might be a place where parents can discuss firearms. And I was recently at a meeting where they have been doing a lot of screening historically for firearm ownership. And they said, we actually stopped screening because that's where parents shut you down and say like, nope, I don't have one at home. But instead we just act as if everyone does, because so many people do. And we just go through our sort of safety training and give out a free cable lock and this kind of thing. And so the screening, yes or no, do you have a firearm at home, is off-putting enough in this context. I think it was either Chicago or Philadelphia, that the pediatricians changed their practice to say, actually, we're just gonna give this sort of safety points check to everyone, which I thought was interesting. And so it's this idea of who's the messenger, right? And who can we engage as messengers? Okay, that's all kind of setting the stage. This is this Baxley-Miller study that's cited a lot, but it's this idea again of what parents think about what their child will do. So it's like a perspective taking of your child. And parents are aware to some degree that kids might be curious about playing with guns if they find it. But that's probably an optimistic view of parents, right? Because I think that especially thinking of young kids, just because of inhibitory control and not really remembering the rules, lots of different things. Kids 0 to 5, I would expect parents would be, even less likely to expect that their child would not play with guns. So this is 9 to 12-year-olds. Okay, I don't think I have a slide on the next, but the other part of this study is that they interviewed teens, like young teens in this age, well, preteens, and they all knew where the gun was in the house. It was a really high percentage. So there's this mismatch between what parents think in terms of whether kids even know where the gun is and what kids will report in terms of being able to access it. Okay, so just to kind of think about these pathways again. So this idea of early parenting relationships and sort of the goal to build parents' awareness of child's developmental capacities, understands child's perspective. Like, it's not that your child, is bad for looking around the house. It's just what a 2-year-old does or what a 3-year-old does. So we'll talk about that. The idea of creating regular routines, predictable routines that include safe storage, will be more likely to create safe and secure environments in terms of firearm injury, and then modeling positive behavior, so that parent modeling pathway. So these are these kind of 3 pathway ideas based on developmental science that we're thinking about exploring in terms of crafting intervention messaging ultimately. Okay. Oh, and then we have to have systems that support parents. So I mentioned a free gun lock. It's very easy to get a free cable lock for firearms. And even in some of the parents that we've initially talked to, not everyone knew that. And so I feel like there's, of course, this bigger picture with, provision of resources to parents. Yeah.
Just thinking, about the prior slide and so for example, in Ann Arbor public schools, right, there is the summer camp for safety and children go through a whole bunch of things.
Yeah.
Thank you. So if you look at the idea that only 53% of the parents felt confident that their 9 to 12-year-old would sort of do the right thing. But there's a massive lag here wherein nobody talks about firearm safety in such a setting where you are supposed to sort of maybe imprint something in a child's brain about firearm safety. So we're lagging far behind other concerns like fire safety and the other possible triggers of harm. So I think that's one of the major problems here. So the research is lacking. The injury prevention science is like way down there for gun violence. So, yeah.
Yeah, I think, and so one of the things, and I'll just talk about our expert model interviews, which I'll say more about, but one of the huge topics we talked about a lot was, and this is where I think the science doesn't know, and I think it varies by child, but is it better to socialize your child and show them and sort of demystify the firearm? Or is it better to, make it a forbidden object and put it away that they can never find it? And I, like, based on like really my eating behavior research, I'm like, it depends on the child, right?
Isn't that the conversation they have about sex ed?
Yes,
It's
exactly
the
right.
same thing.
It's the same thing. And so it's a very,
And liquor, I mean, all of
and
these
any,
things.
any reward driven activity, really, right? And so I think that that's a big area where the science, we can maybe borrow from some of these other domains, but it's really, it's also got a few more layers to it, even because of the political space. We are collaborating with Andy Hashikawa, who does Safety Town and these pop-up safety towns, to actually this spring, we'll be talking with parents there around what kind of information would you want? What would be, what things do you want to know about? And then also in a year or so, working to message at Safety Town about firearm safety. There is, so I don't forget to mention it, it's the Moms Demand Action Be Smart, which they have, and I think it comes out on the AAPS weekly email list, but it's about how to talk with your children about firearms and also how to talk about like play dates where they might go to someone else's house and encounter a firearm. So for example, if the child in the play date house is really accustomed to the family's routines around the firearm, but they have someone over who's new and who hasn't seen it and wants to see it, I mean, what could easily happen in that context. So I think that there's some guidance out there, but it's not, there's more to be done. So that's partly what we're hoping to try to contribute to. Yeah, it's a lot. And so I think just one of the ways that, again, from other research, and I think could transfer over to firearms, but this is one of the things we'll be talking with parents about, is just this idea of meeting parents where they are. Again, parenting is challenging. I do a lot of work on like household chaos, and that I always sort of joke that variable predicts almost everything in most data sets that where it's included in terms of child outcomes. This idea of early childhood, we want to promote autonomy, but it's really hard under even the best of conditions. And this is a place where it's really, if you have so much autonomy and the child finds the firearm, it could be really a bad situation. At the same time, you don't want to hamper development and not have your child support. So in my mind, that leads then to locking up your firearm securely. But how to kind of get people down that path is the big, $1 million, probably over $1 million question, right? So behavior management, outside influences, and so there's sort of the media, and then just how others talk to you about your parenting, about your firearms, et cetera, and competing demands. And so I tend to try to show this to say, we know that households are sometimes busy places. You can't always do everything as you intended. So for example, what has come up in our interviews is, oh, the gun is in mom's purse because she's leaving for the day, or the gun is in the car and mom went out to do an errand. And that, we have all read headlines like that. What happens when the gun is in the car and the child's in the car seat, but maybe the gun fell and maybe the child can reach further than they could reach a month ago and now they got it, So there's all these sort of transitional states that I think are really important to acknowledge, because gun storage, what we're certainly learning from colleagues, it's fluid, right? And if you have, one of my colleagues studies in North in Michigan, I think the average number of guns was like 8, and they had as many as like 42 guns in all. So that's a lot, and not, they probably have different storage strategies for each of them, and different reasons, different motivations to own each of those guns. So it's really complex, and I think overlaying the complex nature of family life is important. And I think, and I mentioned the piece about the pandemic. So the idea that new gun owners who maybe haven't been socialized, like we heard a lot of the in our interviews, my grandpa took me out hunting and showed me how to do this safely, and I know how to do a hunting, and care for my hunting rifle. But if you're a new firearm owner and your motivation to own the firearm is like, I'm scared, the pandemic is here, there's not gonna be people who come and help me. But I don't have that sort of like lived experience of how to be safe around guns. That's a very different kind of situation. And so again, we have not talked to that many parents yet, but we have talked with a few. And that is something they certainly brought up and resonated with. The other thing, and again, I think it really is important for this issue is, asking parents what they want. So as I mentioned, we're starting to do this in Safety Town a little bit, like, would you want information about firearm injury prevention or guns or gun licensing? Like, would you want lots of information about guns? Would you want only information about safety because we're at Safety Town? So figuring out what would be tolerable to parents, having cultural humility.
I have a question.
Yeah, sure.
So with asking parents what they want,
Mhm.
this falls into the great category of depends which parents you ask. And so I'm hesitant because I think sometimes we ask the parents who we know what they're gonna respond, so then we take that and then generalize it to say, this is what parents want.
Yes.
When in fact, as you pointed out, if you were to go to, I don't know, some community anywhere, whether it be in Jackson or in Saginaw or in any other part of the state, you'd get a very different response than if you went to Ypsilanti or to Ann Arbor or, something like that. So I think this is a positive thing, but it's also very, I don't want to say, if not thoughtful, disingenuous.
Absolutely. And it's like it's like the segmenting of the population,
Yeah.
right? It's not gonna be the same. It
We
can't
create our own
be the same.
echo chambers for everything, including what parents want.
Agree. 100%, 1,000%. And I think that that's one of the things, so I'll talk about the experts we interviewed. One of the things we did is we selected kind of using this mental models approach where you don't actually interview that many people, but you carefully select across different relevant sectors. And so my plan is that we will also do this with parents. And I think that we're working with Head Start. We're working with Head Start that will be kind of across the state. We're just in Michigan. We're just going to do Michigan.
There's enough variety in Michigan.
Yeah, and then Michigan's a great, example of lots of different types of settings. And so my hunch is that we will hear really different things from different parents. And I should say also, when I say we, like, I'm not going to be the person necessarily to talk to the parents, right? We're going to have parent like ambassadors, Head Start staff and this kind of thing, talk with parents. So I think that I always like to point that out as well, because I'm so sensitive to that issue that you're bringing up about,
Yeah, I think we're quick to have cultural humility with certain cultures, but not with others.
Yes, and I think Firearms really brings that to the fore. One of the people that we interviewed as an expert is a firearm safety trainer in the UP. And he is also a parent, and he had, I think, like 5 kids, and we just had such great conversations with him. And he's actually worked with a colleague in psychiatry as sort of a like a talking head on their video intervention. So I think we'll be asking people like that also to be sort of have that identity to be involved with this project. That's the goal. That's the goal. And yeah, I mean, I think like really big picture, if I could ban firearms in the home, that would be great. That is not reality, right? And so I think that's the other part, and that's where, like, in this firearm space, that cultural humility.
That gets for me at like it feels like it's a vicious cycle of like, it's not an irrational idea that families want guns in the home because the world or the community is scary and unsafe. And it's scary and unsafe because of the guns. And so then it's like, it's like, how do you break that cycle? And it
Yes.
seems like the only way is, like you said, is like access and limiting access, because guns exist, so people feel scared and unsafe, therefore they want guns. And so it's like all of the, like, when you hear the description of what there is recommended of bullets in one safe, gun in another, it's just not facing the reality of like the front door feels unsafe, and like having two locked places doesn't get that. And so then it feels unbreakable unless you cut off the supply, and that's feels impossible. That's why it just feels so
It's
insurmountable.
Yeah, I agree. I think one of the interesting things also that has come up is around sort of technology and how technology is going to be helpful. I don't think it's there yet, but that idea of the quickness, the quick access, I think some of that will be addressable in terms of tech-based approaches. But
You mean like those fingerprint?
yeah, like an immediate, like a biometric. And biometric safes, face recognition safes. But these have also, I don't know if people saw this case, but there were a number of biometric safes. I think they were face recognition. I can't remember, but they failed. And so kids could access, they were all unlocked. And so there's that danger of trusting in technology, again, for this high stakes topic. So I don't think we're quite there yet, but I think there's a group, and again, this is where I like the idea of focusing on early childhood. Someone said something about like building habits and routines, or maybe I made that up, but that idea of if we can get this set up early in the child's life and in the family's life of gun ownership, and think about it in a baby proofing way, then that could be a habit that is maintained over time. And then adolescence is a whole different story.
So as a primary care pediatrician, one of the things that I think it will be important to keep in mind is that many families don't just have one child. And
Oh,
so
for sure.
when you're thinking of get this in the infant sphere, they may have 3 older siblings. And so when you enter into this discussion, depending on your relationship with a family or how you want to create an educational effort, just because they have an infant doesn't mean they don't have older kids in the home. So just keeping that in perspective.
Absolutely. And one of the groups we've been working with is working with Early Head Start, and we had a big discussion about to the parents in the intervention, does it have to be the first child? That would be easier.
Correct.
Even if it's the first child, firstborn, there's always other people, right, coming in and out of the house too.
Maybe.
So, so a consideration, but absolutely that older sibling piece. And that's that data set I mentioned from the CDC that's kind of going into each incident.
Yeah.
One of the things they're tracking is like sibling presence, because we know how that works, right? We can imagine lots of different sibling modeling. So they're hopefully going to be able to getting more data around that. Let me make sure. Okay, this is I always show this slide too because I love it, but this is the other piece. Well, here I'll go back. There have been some studies that have looked at really communication and even co-parenting, which is something I do in my eating behavior work, focused on safe storage and family conflict. And again, it's somewhat related to IPV, but not all. So it's sort of, there's some communication experts who are really looking at different types of communication around storage. And usually this is the other thing with recruiting families and talking, who do we talk to in the family? It's usually, if it's a 2-parent family with a mom and a dad, it's usually the dad who is in charge of the storage of the firearm. Thinking about like the current, case in the media right now, the Crumbly case, that's playing out in that case, that the dad is in charge of that firearm. Okay, so we want to also talk with dads. So we have some colleagues who are working with dads specifically, and so we're going to be reaching out to dads as well. I mentioned this here, I'll kind of zip quickly because I watched our interview stuff, but This is another piece around just the individual differences of kids, right? And so highlighting to parents, again, in other domains about, hey, kids are different. If you have two kids, one may be the one who's gonna run out in the road, one would never run out in the road. But so how do you, sort of adapt your parenting to address the needs of different kids? We know also that, from Barbara Mornigello is someone who does injury prevention, and that parent perception of the child's risk-taking likelihood is also very predictive of their safety practices, right? So they're like, my kid would never do that. They're so low key, they would not explore. Those parents are much less likely to take that kind of hazard removal, injury prevention practices to heart. And so I think you can kind of work with that maybe as an intervention tailoring piece, in terms of thinking about how different kids are different. So we've done some work in that area around temperament and stress regulation in terms of other domains of intervention. Okay, and I think this also kind of gets to what we were talking about a little bit, but this idea that I also tend to talk about a lot is trying to avoid parent blaming, because like we're really, really good at doing that in public health. We're good at doing that to some degree in pediatrics. But really couching the parent as the expert, but kind of highlighting this idea of like, there's some gaps in your perception as a parent, maybe that you haven't thought about before. And did you know that this is possible? So figuring out and then working with a communications person and involved in this messaging piece, but the idea of being able to sort of have parents go, oh, okay, I never thought about it in that way before, like a 2-year-old can shoot the trigger, or like the child is most drawn to a moving part, which is going to be the trigger. And that's just natural. That's just developmental. That's just like what kids do, So we heard from some folks who we've interviewed and talked to already around hiding things. And so like, oh, the gun's hidden. So, it's safe, like it's hidden away. But at the same time, in that same conversation, we've talked about, well, kids love to look for hidden things, right? Like all kids know like where the birthday presents are hidden or the hiding places that parents use. So in fact, hiding it, especially if it's one of those typical places where you hide stuff, your kid knows where that is. And so that study that I mentioned earlier really pointed out that gap. Okay, yeah, for sure.
I think one of the challenges here, and this is not unique to this particular space, of course, is that the absolute number of injuries is low, right? They're all devastating,
It's all
right?
unlikely.
Your own relative risk of any given family with a gun, of having a child that injure themselves seriously with a gun, even if they have a gun, even if you leave it unlocked and loaded, is still low. So I guess there's a problem. This is always the case in primary care pediatrics. We're always trying to counsel against. Yeah, like
Prevent the rare event.
Yeah, and it's tough, right? So to some degree, people blowing this off is not irrational, right? Particularly if there are more distal and larger risks, right? Car accidents, those types of things that people will think, yeah, I should wear a seatbelt, those types of things. So I don't know. This is also a problem from a funding standpoint, I think, right? Because policymakers are not going to be moved unfortunately, by 600 deaths. I don't think. I just.
They haven't been.
They haven't been.
Michigan last week with 14, they just started, again, it's policy, the implementation is gonna be, of course, the challenge. But there's now a child access, secure storage law on the books in Michigan.
Yeah, fair. I'm thinking like the amount of investment
Oh, yeah.
that's gonna, like, deep, like, investment in actual policy changes that are gonna make a meaningful difference. Unfortunately, it's like you'd have to have double, triple, like, I don't know how many, right? So I just feel like this.
We need more firearm deaths.
We need more deaths. But that's the solution.
That's the wrong approach, because this is, every death is a wrong death.
Right.
Okay, so it's not about statistics here. It's not about, we have to have 500 to convince policymakers. One is too many when it comes to gun
It
violence.
should be.
Right.
It should be, but it's not. That's my point. I'm not saying it's not I'm not making a judgment about, I certainly disagree with the idea that it's not enough. But this is to get people to move, right? on risks that are small is very hard, whether you're a policymaker or a parent. I think that's, and I don't have a solution. I'm just making an observation.
Yeah, no, I mean, I think that is true, but I do think there is this potential for movement, partly because guns are so ubiquitous. They're just, we can't it's out of the barn or out of the gate, whatever that expression is. I mean, it's just too late. There's just so many guns and ghost guns and this kind of thing. Like, they're just, can't make them go away, unfortunately. And so I think that policy piece, like, I think people can be policymakers, we know can be like moved by story. And this is a particular, and I think that's again, in the early childhood space, it's easier. But the idea of being able to move with, this blameless child, this,
You need a senator's grandchild to get shot.
That's
what
that's
we're
kind of
talking
like, I mean, yeah.
Yeah, I mean.
If you can arrange that, I think you have a much higher likelihood of success.
But can I just say that I'm sure you,
Yeah.
I mean, fatality is not the point here. There's a
It's
lot of
access.
morbidity that comes from gun violence. So it's over 6,000 kids were shot last year in the US with more than 400 deaths. So I think we need to be careful about sort of this idea of statistics and, effect size. That's not the point. The
Yeah.
morbidity is massive. And, I'm gonna keep quiet because I think if we worry a lot about what policymakers, I personally believe all the policymakers from number one down to should all be fired, because I think the number one killer of death should be of children, killer of children should be addressed head on as a country, but we're not doing it. So.
I mean, to your point, how do you move people on rare but catastrophic
Yeah.
things? And I think, the answer is it's a combination of these things, right? It's story, it's the human, I can connect some, devastating something where it seems like, everybody can identify this shouldn't have happened. And, we deal with what, O was talking about in the asthma world, where every asthma death is a death that shouldn't have happened, but there aren't that many of them, but the morbidity is huge. And so if you think of like one child gunshot victim that lives, and the expense and the morbidity and the life trajectory that gets altered, like, then you can start building the statistics that may, motivate policymakers. That's not gonna motivate a parent, but
Yeah.
Like Andy Hashikawa and I have talked about this, but I'm gonna jot it down as the morbidity story angle and cost angle. Yeah, I mean, it's we don't know what moves policymakers, and then once the policy, so they did like this month in Michigan, there have been like massive policy changes to gun storage and FERPO laws and extreme risk protection order laws, and I think that probably wouldn't have happened, maybe without Michigan State, maybe without Oxford, I don't know, but like those are, again, rare catastrophic events that were preventable, right, ultimately.
but that also impact a community.
And impacted.
Right, so it's
And
not,
very relatable.
it's the individual child and the family of that child that's impacted, but in those particular, when you have a public situation, it's the whole community that grieves and gets affected, and that also motivates people.
But I also don't know that it motivates in the right way though, because it makes the world feel scarier and more unsafe, which I think, so I don't know that I would necessarily say that those events would necessarily push people towards less gun ownership. I think I see potentially people feeling
But a
more
universal
safe.
Educating also saturation of gun ownership, just like not in all pockets of individuals, but like the number of firearms outnumbers the number of individuals in the country. So we're so saturated that it does, because I agree that the fear is a high course. Right?
So you may not change ownership, but you can sell a universal education program in safety towns.
That would
And,
help.
when you do sex ed in middle school, you can do sex, drugs and rock and roll and guns, right? Like you can.
And I totally agree, and I think that the other model is transportation and car safety, driving safety and seatbelt expectations now. So I think when you talk with people in the Firearms Institute, people used to not wear seatbelts. They used to design cars in really different ways. And now we have built in all these safety features to cars. And that's why I also think that the technology with firearms ultimately is, we're not there yet. And any injury or death that happens is preventable in too many, but I think that that's a potential path. Again, because, sorry.
There's just a comment in
Yeah.
in addition to the morbidity, there's also the mental health piece.
And at a community level, like from this individual all the way up,
I mean, it's so, I agree with all of it, and I'm just like, oh, how are we gonna do this? But I think, so let me go to, okay, this is this mental models idea. So basically, we're interviewing experts, we're interviewing parents, we're gonna try to identify these like kind of misalignments or mismatches a little bit in their understanding. I just want to show, this is the kind of a flyer and idea for the study. So here's what we did this fall, is that we talked with these experts. I've sort of referenced some of the things we found out in the interview so far, and we talked with 9 people across law enforcement, firearm injury prevention researchers, who are a dime a dozen around here at the University of Michigan, but not only in Michigan. Like a Moms Demand Action advocacy people and a firearm safety trainers. And we basically just did this very, very open-ended interview where it was like, think about a household that has both of these things present, a firearm and a young child. What are some things that might happen? And then we kind of just took people down the path of thinking about when or under what conditions, like would a child ever see a gun? Would they ever find it? Would they ever touch it? Would they ever fire it? And so these are just sort of a rough estimation of the topics that were covered. So we talked about the storage and what the recommendations are, why parents may not follow. And again, a lot of these people were parents. Individual factors, the socialization issue that I mentioned earlier, and other locations and people. So that idea of like, people are coming in the home, I do great storage, but then either my child goes to another place or they go to their daycare, which has also happened. Or my gun is in transition and I take it in the car, I put it in the car because that's, where I need it, or I'm running errands, or I have to be coming to a place. I have my concealed pistol license, but then I have to go in a place where I can't bring my gun. And so I have to leave it in the car. And so that creates a transition state where it's not on my person, or it's on my person and my young child is crawling all over me. Which just in like my research life, we've sent, had RAs go do tons of home visits pre-pandemic, and that situation was there too for the RAs. And we were like, you can leave, if you don't feel comfortable, if there's a gun out visible on the coffee table. She's like, it wasn't me, it was the toddler crawling around me and the gun was visible to me, so that situation, even in a research visit, can happen. Sorry, I know I'm like pretty much at time. This, I sort of hesitate to show this model because it's really a little bit of a mess, but I'll show it. Wait, sorry. That's why it's kind of crazy. So the expert model ideas, like these blue circles, are kind of what the experts were saying, this is the case, this is what would happen. The orange circles are kind of this idea of like what parents might think, and then this yellow is kind of child action. So I'm just going to circle this top part. The experts were really saying, okay, in the blue circle all the way on the left, like young kids are curious and want to explore. I think we'd all agree with that. The idea that like a parent might think, oh, if it's hidden and high up going along that first line, then the child won't find it. Or like, I'm a responsible parent going down, so I can supervise and watch my kid all the time, but we all know that's not probably possible. Like you turn your back for a minute, so then the child might find it in that moment. I'm a responsible parent, whoops, that's supposed to be like gun is always watch. Anyway. So the child won't be able to touch it. So like thinking about all these different, like, there's these like mental model pathways, like belief about how things might happen or might not happen. But basically the experts all came down across all those sectors to say, you can't supervise the kid and the gun all the time. So the kid will find things eventually. Again, it's sort of child development people, we could like see this. Kids, not all kids. some kids, even if they have the rules, they don't always follow the rules. And so then maybe they would touch it, even if they have rules and they could touch the gun. And then the idea that a child's too young, not strong enough, kids grow faster than we think. They're that developmental trajectory is fast. So all of these things could happen. Basically, the idea of the baby proofing that I mentioned right at the beginning. Some of the experts said, you just absolutely have to lock it up and have safe storage. And that's basically where most of them landed. Some of them landed here saying, well, there's other ways other than locking it up. If you put more steps between the child and the gun, like you put it in an outbuilding, you put it up high in an outbuilding, you lock the door to the outbuilding, but the gun itself is still not locked. So there was a little bit of not disagreement, but like not 100% the same message from the experts. And then here's the idea, like if your gun is unloaded, parents might have the belief it must be loaded because it must be ready to use because it keeps me safe. So back to this fear point. So I was saying like, there's like an end run around this idea of has to be loaded. And so that's how I am safe. And then it must be unlocked. So here the experts were saying it can be fast using technology and other things. And it can be easy to load and then you can use it, have it ready to use so that you feel safe. So I know I'm over time, so I'm gonna just, there's Safety Town. That's the law that I'm mentioning. So if people are interested, like the IFIP website does have these sort of explainers and things to hand out to parents, put it in a pediatric office. If you're curious about the new laws, here's what they mean for you. So we'll be asking parents like about awareness of the new laws. And I don't know, it helps or doesn't help that like the Crumbly case is right now in the news, but it feels incredibly timely and important. And so this is just that child access prevention law, which is probably the most salient for the safe storage piece. And I think that's it. So I can pause there and guys have an email, but sorry, I went a little over.
No, that's wonderful.
And
Thank you very much for coming. This was wonderful, very timely and very important.
yeah, well, I welcome any thoughts, questions, suggestions, because
Did you interview any parents who they themselves did not own guns about how they teach their children to deal with those situations?
Sure. One of the Firearm injury experts, that's like her research.
Okay.
So we talked about like that Be Smart program. So even if you are like, everybody can be part of the solution idea. So bring it up, talk about it. Don't be afraid to ask about it on a play date. Make it be like, oh, my child has food allergies. This is the Be Smart guidance. They actually give like language that says, guns, I guess guns are really ubiquitous. Like they're having us ask about play dates, do you guys have a gun? And, do you store it? And also if you're the gun owner saying like, oh, we do have guns, we lock them, here's how we manage it. And so just trying to like destigmatize it a little bit, which is really hard. Really hard. So, but I think that that's one of the ways that we can think about that other development of normalizing. They're all around, they're hard, they're not going away. And here's how we manage it, normalizing the storage and the management. That's cool.
It must be really tough to be developmental psychologist today, because when we talk about gun violence, right? So you talk about kids at Oxford, same kids were at Michigan State University. So my kids actually are so well versed when it comes to what to do when there's an active shooter. I will be a disaster, right? I said this at one of our national meetings, just talking with people, like there are 9,000 of us in this auditorium or convention center. But to be honest with you, if there was an active shooter, they would kill most of the pediatricians here. Largely because we would know nothing about what our kids essentially, rather than learn calculus, algebra and all that, are learning how to stay alive. And that's been their trajectory from toddlerhood through their teenage years, through their young adult life. So as a developmental psychologist, I'm sure you see all this. It's just so scary. So beyond the fatality, as we were just talking about, is what have our children become? You know, they won't tell us all this at home, but our kids are suffering because of this scourge that's ongoing. So God bless you, developmental psychologists.
Well, and it is that, actually at this meeting, there was someone who was studying that, those drills in schools, which probably many of our kids have done, right? And, I never did, but the impact of doing those drills on kind of mental health and anxiety and, you know, in the context of, you know, the rest of the world as well. And I think it's part of all of the many overdetermined major contributors to our mental health crisis. I
Yeah.
totally agree.
Because I mean, there are those that oppose the idea of having those drills in schools because of the downstream effects of it. But to be honest with you, what else are the kids supposed to learn? I mean, the professor at Michigan State University didn't know what to do.
Yeah.
One of the students grabbed his belt to go turn